Welcome back, everyone, to Part 18 of the 150-part Inpatient Diagnosis-Related Group, or IPDRG, Masterclass. I'm your host and lead instructor, Harshal. Now, if you are enjoying this lesson, please like, share, and subscribe to this channel, and share it with friends for this free course on Decode Healthcare with Harshal. Today, we are absolutely unlocking some of the most fundamental building blocks of medical coding, so let's get right to it. Real quick, before we jump into today's specifics, let's just do a super fast recap of Part 17. Remember, every single ICD-10 PCS code requires exactly 7 alphanumeric characters. You cannot have 6, and there's no way you can have 8. Every single character position holds its own specific meaning, a really crucial piece of information about the procedure, the service, or the treatment that was provided. It's this beautiful, fully combinatorial system that basically builds a complete procedure profile from scratch. Okay, let's dive into this. Here is our roadmap for today's lesson. We'll start with the Section 0 overview, then move into the 31 body systems. After that, we'll hit the core anatomical guidelines, explore general anatomical regions, and finally wrap up with a summary and tease our next lesson. All right, Part 1, the Section 0 overview. We are zooming right in on Character 1 today. So what exactly happens when that very first character of your code is a 0? Well, a 0 in the first position locks us right into the medical and surgical section. And let me tell you, this is by far the largest, most frequently used section in the entire ICD-10 PCS code set. Why? Because it covers surgical and medical procedures performed on native body parts or anatomical regions. So it encompasses the vast majority of procedures a patient might undergo while admitted to a hospital. From routine appendectomies all the way to complex amputations, if it's a primary medical or surgical intervention on a native body part, it's gonna start with a 0. Let's look at how this brilliantly plays out in a real-world scenario. Take a CAB-GB procedure, a coronary artery bypass graft, using an autologous artery graft. The code for that is 021003Z. That very first 0 anchors us right there in the medical and surgical section. Then we just read it left to right like a story. The 2 tells us it's the heart and great vessels. The 1 is our root operation, bypass. The 0 is the specific coronary artery body part. The 3 signifies the open approach. The 1 identifies the autologous graft device. And finally, that Z means no qualifier. 7 characters, 0 ambiguity. It's actually pretty elegant once you get the hang of it. Which brings us perfectly to Section 2, the 31 body systems. This is all defined by Character 2. So Character 2 divides the human body into 31 distinct physiological systems and anatomical regions. Now, I know hearing 31 systems sounds kind of overwhelming at first glance, but do not panic. We're going to break these down into really digestible, logical chunks. The creators of this code set were incredibly methodical, as you'll see. Let's start by looking at the first 2 logical groupings, the nervous systems and the cardiovascular systems, which utilize the numbers 0 through 6. For the nervous system, we've got 0 for the central nervous system and cranial nerves, and 1 for the peripheral nervous system. Simple enough, right? Then, jumping over to the cardiovascular system, 2 is the heart and great vessels. From there, it just logically splits by upper and lower. 3 and 4 are your upper and lower arteries, while 5 and 6 are your upper and lower veins. See? It's incredibly systematic. Now let's move to the musculoskeletal systems and see how this builds. Here, we actually shift away from numbers and into letters. Notice that upper and lower division again? P and Q represent upper and lower bones. R and S are your upper and lower joints. Meanwhile, all the soft tissues supporting that bone framework get their own characters too. K for muscles, L for tendons, and M for bursa and ligaments. And the head and facial bones? They just sit right up top with the character N. Finally, we group together the remaining major physiological organ systems. B is respiratory, C covers the mouth and throat, D is gastrointestinal, F is hepatobiliary and pancreas, G is endocrine, H is skin and breast, T is urinary, and U and V cover the female and male reproductive systems respectively. Guys, as a medical coder, your anatomical knowledge is absolutely paramount here. You can't just know what an organ does, you have to know exactly which system ICD-10 PCS categorizes it under to nail that second character. Now that we know the systems themselves, we really have to talk about the rules that govern them. Let's shift our focus to Section 3, Core Anatomical Guidelines. First up is what we call the diaphragm rule. Remember how we saw earlier that arteries, veins, bones, and joints are strictly split into upper and lower systems? Well, where exactly is that dividing line? The official guidelines state that an imaginary transverse line right at the diaphragm dictates upper versus lower. Literally, anything above the diaphragm is upper, anything below the diaphragm is lower.
So, for example, a procedure on the brachial vein in the arm is upper, giving it character 5, while the gastric vein down in the stomach is lower, taking character 6. But here is a classic coder's dilemma. What happens if you're reading through an operative report and the surgeon performs a procedure on a very specific portion of a body part? But when you look at the PCS tables, that highly specific portion doesn't actually have its own body part value. What do you do?
So, the crucial point here, the golden rule, is found in Guideline B4.1, the whole versus portion rule. It plainly states that if a procedure is performed on a portion of a body part that doesn't have a separate specific body part value, you just code the body part value corresponding to the whole body part. For example, if a procedure is done on the alveolar process of the mandible and there's no specific code for the alveolar process itself, you simply code it to the whole body part, which is the mandible. It saves you from guessing.
We also have the proximal branch rule. You're going to find this one especially relevant for the cardiovascular and nervous systems. If a specific branch of a blood vessel or nerve does not have its own specific body part value in the tables, coders must actually trace the anatomy back. You follow it up to the closest proximal branch that does have a specific code value, and you use that one. All right, moving on to our fourth segment, Section 4, General Anatomical Regions. Now, these act a bit differently than the specific organ systems we've covered so far. There are 3 characters that represent general anatomical regions. W is for anatomical regions general, which includes broad cavities like the peritoneal cavity, the chest wall, or the abdominal wall. Then you have X for anatomical regions of the upper extremities, and Y for anatomical regions of the lower extremities. Now, what's really interesting here is the strict limitation on these codes. You must remember this. You only use anatomical region codes when a procedure is performed on a broad cavity or region rather than a specific individual body part. Or, occasionally, you use it when the physician's documentation completely lacks the specificity needed to identify a discrete body part. For instance, if a surgeon is draining excess fluid generally from the abdominal cavity, that goes to W. You don't just guess a specific organ if it was clearly a generalized regional drain.
Excellent work today! You've just successfully navigated through the intricacies of Character 1 and Character 2 in the medical and surgical section. Let's move to Section 5, Summary and Next Lesson.
Okay, let's lock in your masterclass takeaways for today. First, Section 0 is your bedrock. It is the go-to for native medical and surgical procedures. Second, remember that Character 2 divides the body into 31 distinct physiological systems. Third, the diaphragm is your absolute transverse dividing line for upper versus lower systems. Fourth, always apply Guideline B4.1 to code to the whole body part if a specific portion value doesn't exist. And finally, reserve W, X, and Y strictly for general cavities or broadly documented regions. Next up in this masterclass is part 19, and trust me, it is a massive one. We are finally going to tackle Character 3, the root operations overview. We'll be looking at all 31 operations and the 9 intent groups. I want to leave you with a provocative question to chew on before our next lesson. How does the fundamental intent of a surgeon, like whether they're taking out some of a body part versus just altering its root, completely change your coding trajectory? Think on that. If you are enjoying this lesson, please like, share, and subscribe to this channel and share it with friends for this free course on Decode Healthcare with Harshal. Keep studying, stay focused, and I will see you in part 19.